Hey guys, it's Mitch Ibach. I'm an optometrist with Vance Thompson Vision in Sioux Falls, South Dakota, and I'm here at the 2026 Optometries meeting in Phoenix, Arizona, and I gave a talk with one of my good friends and colleagues, Dr. Damon Durker, titled An Optometrist's Guide to Interventional Glaucoma. And this is really a focus of our practice. How do we be more interventional in the glaucoma space? And I'm a big proponent of interventional glaucoma includes optometrists. And so we talked about consolidating medications, trying to move to fixed dose combinations, maybe using preservative-free options for glaucoma drops in our patients, and also thinking about the comorbidities that preservatives in some of our glaucoma drops can lead to, maybe like neurotrophic keratitis. We talked about laser trabeculoplasty, using laser to rejuvenate or clean out our patient's natural drain, working that in combination with glaucoma drops in some patients or trying to lessen the medication burden for our patients. We talked about drug delivery, including bimatoprost SR and travoprost sustained release, using these pharmacologic drug delivery devices to be able to use great pharmacologics, but just taking them out of our patients' hands from an adherence standpoint. And then we talked about minimally invasive glaucoma surgeries and where that fits. And I think of interventional glaucoma, we're going to use all these modalities for our patients. We're going to use drops to treat glaucoma. We're going to use laser. We're going to use drug delivery. We're going to use glaucoma surgery. It just really depends on how do we put the modalities or the treatments in the right order for the patient in front of us. And so we talked a lot about that, gave some pearls that we use in our practice, and hopefully had an audience that got a lot of pearls out of it. Yeah, I'm a huge advocate for collaborative care. And so I think it's so important to make and grow relationships with our ophthalmology counterparts and really just do what's right for the patient. And so the patient in front of you, whether you're able to do laser trabeculoplasty in South Dakota where I practice, we can. But if you're in a state where you can't, still SLT is maybe the right option for that patient. And so I wouldn't let the who's doing the procedure get in the way of doing the right thing for the patient. Yeah, I think we have to listen to our patients and then see what the signs are telling us. And so maybe it's a patient who you can tell is not being adherent with their topical glaucoma drops. If you ask the right questions, you can glean that this patient is not using their drops correctly or on a regular basis. Maybe it's the ocular surface. Maybe it's a patient who has central corneal staining with sodium fluorescein, or they're having side effects like redness from the drops, and we need to make a switch for that patient. And so let the signs and symptoms tell you when a switch is needed, because I have lots of patients who do great on topical glaucoma drops for many, many years. And so we don't have to switch just because the option's available. Yeah, I think it's really important to use technologies that are able to put more of the emphasis of success on treatment in the doctor's hands. And I think that's one of the key pillars of interventional glaucoma, is trying to do procedural approaches or fixed dose combinations or preservative-free meds where we're just going to take patient non-compliance lower and lower. Again, some of my patients do well on glaucoma drops for many, many years, but it's important that optometry knows these options are available, knows how to comfortably talk about them, educate our patients. And at the end of the day, I think the patient in front of us just wants a recommendation from their eye doctor. And so be confident in giving a recommendation of what you would do or recommend. I hope everyone has a great time in Phoenix. Stay cool, get a neck cooler, and drink lots of water.